First John chapter 3 verse 17. I read, "But if anyone has the world's goods and sees his brother in need, yet closes his heart against him, how does God's love abide in him?" So St. Luke's project is the health arm of the Hope Journey. In as much as we are going out to present the gospel to people in the selected communities, we have to look at their health also. Last year I made a statement and I'm stating it again. What will happen? How would you feel if whilst you are presenting to the person the gospel, the person passes out? Or right afterwards, the person passes out? You may have the thought, say, the person believed the gospel, and so we are hoping the person will join God in heaven. But we all know a sign of a saved soul is the change in character that we didn't see. So a way to also help, aside presenting the gospel to people, is to what we mostly do on the field. We do health screening for our people, and that will looks at the physical well-being whilst we are donating our items also. So yeah, I just summarized this nicely. So let me go straight to our challenges. Yes. I wish I could just highlight this, and then that would be it. Yes, we have very, very limited resources and then funded. Before I continue, please, our board of trustees, the budget I'm about to present will blow your mind. Please do give us at least 70%. We beg. And last year there was, although we had people translating and helping us communicate to the people, there was some form of language and cultural barriers. Don't worry, language is under the culture. No one came to dance there. And then access to healthcare professionals. We have a good number, but if you're able to increase the number of people we have, yes, it would. Thank you very much for joining. Camera meet me so that. And then sustainability of care, in that we go there, we do the screening. From our histories we take, our discussions, you realize this is what a person may be struggling with. We advise, but then when we leave there, that's it. How sure are you the person continues? Because you may, last year we in our previous years we've been leaving some form of notes for them to take it to the nearest clinics or hospitals. But I know very well, that's the end. If you don't cry, push your. So how sure is that this person will even walk to the hospital to continue the treatment or the care? And the last one, time constraints. Mostly when we get there, we are not able to get enough time. For the test, sometimes you're able to finish. But when it gets to the parts which is also very important, I won't say most important, is getting to discuss with them based on their tests and complaints, because that will give a fair idea of the courses and what you can do to help the person. But mostly that one takes time, and because our time is limited, we are unable to do enough, and I don't know how we can solve that.
How much time do you normally have? I mean, so we leave what?
Yes.
So how many hours?
Averagely, how many hours do we spend there? Always.
Adam was like 8 a.m. to 2, right?
That's like fair shift.
No, we left here at dawn. We got there around 8.
Are you sure it wasn't 9? We got there 8, but started around 9.
Yeah, so we had to wait for them.
So it's even less than fair shift.
Well, you cannot get
In a hospital setting.
So, how about planning? Okay, you get there, see your number, look at the time you have, and then prioritize.
But as you said, more hands will help.
So we
With
have
it-
limited hands.
But with the
I take away from you.
If you get small hands, it will
Yeah,
help.
I
So
get it.
we should see if we can find a few health people from outside who are willing to join.
I was about to
Yes,
say.
and I want to take from you this.
no. Let me
And then also
also
sometimes
the more hands.
there is this school of thought that we can't we can't fulfill everybody's wishes
Yeah.
in a day.
Yes.
So let's just leave a mark and then we'll go and come.
Okay.
We know we will not.
Yeah.
Okay. Yeah, so here are some suggested solutions and improvements. Yeah, so with the limited fund, we suggest that we increase resource mobilizations and partnership. I know this is very hard, and Ike already mentioned it that going in for sponsorships and partnership is really difficult because of our standard, sorry. And so, but we beg and we plead with our board and our associates that please let's look at health more. And then we go ahead to the volunteer recruitment and training. So in as much as we need healthcare people, we are pleading with everyone here. If you would want to leave your team, or if you don't have a team, our arms are wide open. Come to us. Yes. Come to us who are unhappy with their team,
So I think the focus should be
and we'll give you rest.
who don't have teams, because since in Nigeria, yes, I'll be
Okay, so the second,
Let's
Some
say,
people don't even have them in the school.
the second,
What's normally your number?
we are mostly 6, 5, 6.
Continue.
Agenda fire. Also on this same point, we suggest that we do kill and aim for you. So yes, we suggest that if possible, we partner and coordinate the activities with health centers around. If there is a clinic, and then we can get some of the nurses on board to come and help us. We will be very much grateful. Or any of the other health, the medics, yes. And the training, if you are able to have, unfortunately, this is the time we are supposed to do the training, but most of us are not here. If we are able to train and get our hands on the things we are supposed to, become better at our skills, I believe we can fast forward things. And then sustainable care and follow up. For this, we always say we'll call them. We always say we will get back to them. But sometimes you realize even the numbers they give. Last year, let me not even go far. Last year, most of them weren't having phones. You ask me, use phone. I just say Mkobisa. And people are also in line. I just say in the next. But we are hoping this year we can get some contact and a new follow up, so that we can counter and better the problem of a sustainable care. And then we'll set up early and extend the field time if possible. This time we are going to somewhere very close to us. And so
it's not negotiable. The time we leave now.
the time we leave now. So we leave at 5 a.m. to this time.
5:30.
a.m. this time.
Hey,
Then
you go and set up and wait for the people rather than being waiting for us. I think that has been the
it's a record, right? 5:30 a.m.
Yeah, we are planning to sleep at
Hey,
5:30
no
now, when the driver will come.
I'm about to not say it. If they do the time, the time. Maybe some questions.
Yeah.
Again,
This is a budget and funding. Oh, are you funding? Yeah. But the most important part.
Hey,
Don't worry, I got you.
okay.
So if you go through with me, so mostly when we get there, this time we want to, if you're able to get the funds, purchase most of the things we need. I forgot to include some of our challenges is that we don't have enough equipment, and so this time if you're able to raise enough and get, I don't want to get ahead of myself, but and get this amount or something around this amount, we'll be able to purchase. We'll be able to purchase the things we need for future. Exactly, yes. I'm thinking of posterity also. I'm that good.
Make up most of that. So if we take those out, the items you need ASM. Down to one for
the one,
and then one for.
oh, it can be done right now.
So that we know where.
So if please you may your calculators, yes. So 1,750. 750 plus 2,800 plus 3,750. I'm just picking out the test. No. The lancet, we need lancet 100. Yes. And then 600. Cotton wool and sanitizer, very important. 50. Yes. Plus 370. And then 160 for examination gloves. Yeah. Decent. 9,580. Yes.
3 times the amounts are allocated for you. At the end of the project proposal.
Are we now seeing this?
Go on the website.
Are we now seeing this?
We are now seeing this. For this one, we are now seeing this.
But you said it's 3,000 there.
I think you have to watch the project.
No, but with that amount, if you be honest with ourselves, this common malaria test kit. Malaria is not common. Just malaria test kit. It's
So it's not our industry, so.
And this is for 200.
yes.
It's not
200.
Yes.
It's not you. You are doing the right thing. We have a bad year.
This is what happens. Last year, sometimes the treatment we for instance, if for sugar, they look at you as when you are old, then they do it for you. So we look at you when you are old, then we do it for you. But just recently, before I came home, during our clinical internship, I even saw someone I'm older than having diabetes. Not someone, people. How I just say so diabetes. intensive patients, 20 years patients. So it indicates that we have to extend it. We have to increase our reach, and so please.
So your team members can also wait here.
Do something about it.
MSM to us.
She needs advice.
Yes, nothing you are more wait to be out everywhere. Maybe that's a more fast camera.
So even you know, see, the problem is face to most equipment, yes.
Yes.
Fake and stuff. So what they say, that one is inside. Let's figure out. Try to get one or two in addition before you.
Those are the ones I took out
You
there.
want to hear my story?
9,850. Sorry.
You said your store as well. But can you reduce the quantity?
So it means we're looking at 200 people now.
You are looking at 200. And 200 limit. I was in 200 limit, but you started the effort. Okay.
I'm sorry.
So these are some of the people.
Oh, sorry.
Where would you know?
There are more actually, but on and off is why. Jack, sorry, that's how I write.
And oh yeah, in my home. Yeah, the one you
Which are you part of? So thank you very much. I'm supposed to take the questions now, but so you are.
Bro, who's that? Now can we say first person I know? It's like, why? It's not about the time. Who's that? Say, oh yeah, oh sure, no more. You'll be coming. You know who be a man, so you don't have a limited time. About 20 kinds of money for. That's what I say. So, sometimes if you're not more in meeting, but you are still people working.
Always.
It's not about the time or the equipment we get, but people will still come. That's the problem.
Come on.
Please.
So, but I like to commend you guys. You guys, mom can be that dream hotel. I don't care. I want to do. I'm saying you do so well that it's never like
I want to better it, so please look at the 14,000 first.
On the number 2, we can't go more than 6. We want to do the half. We have to. So 6 is what you get. But to make your work effective, you can plan, take time, go there to the health facility, talk to the people and recruit them for them. So
Okay.
that on the day you put them more people help you. You assist wherever we can.
Is there a health facility
Oh,
around
I'm sure. No health facility.
at Signboard?
This
Signboard clinic.
It's still a facility.
Oh yeah.
They're not getting it, you know.
So have you then get nurses? Have you then get nurses?
There was this place I acquired. Nurses be joining.
Yeah. They last year they came to even.
So let's get close by assist us on the thing.
Okay.
And with your budget, right? We'll get back to you. Okay?
Is there hope for me?
Oh, hope there's always hope.
Yeah, I hope there is.
You are licking my brain. Alright. So thank you very much.
Thank you.
I think okay, so
Okay, we are on with the presentation for the stationary team. Asamoah Bernard Fianco, the leader of the stationary team. So, our course overview, we are to empower education through stationery, a part of the Hope Journey course. So, our mission is to provide essential stationery supplies to underprivileged students, supporting their educational journey